We want to thank you so much for joining us. And we have continued to do these because we have gotten so much feedback from our patients stating how valuable these are. We recognize that our consultations sometimes can't be an hour long and we can't get to all your questions. And so we continue to do these so that we can add the value of educating you. We educate people all over the world, but you are extremely important to us, and we want to be able to add that value to you and share what we share with colleagues all over the world with you as well. And so that's why we continue to offer these webinars that we started during COVID to stay in connection with you, but that we've continued on because of how popular they have been. In fact, this is the greatest webinar that we've had in number of registrants, almost 300. And so we thank you, and hopefully this will be eye-opening for all of you. This was inspired by a talk that I gave about a year ago. It's, as a dermatologist, I have the bias of always really prioritizing the skin, thinking about the skin when I do treatments such as injectables. And for those who are on that are my patients, you know that I always incorporate or recommend either an IPL in Clear and Brilliant, or perhaps even a CO2 laser. And today I'm going to be talking about a little bit on the science of why I make those recommendations. So with that, Risa, I don't know if you have anything to say before.
Yeah, so I just want to formally welcome you all to the latest webinar from Cosmetic Laser Dermatology. We're very excited to be here today with Dr. Sabrina Fabi. This talk is called Beyond Skin Deep: The Impact of Skin Health on Perceived Age and Attractiveness. Dr. Fabi has a great presentation in store, and then we have some time for question and answer. This is being recorded, so you can always rewatch it later or share it with any family or friends that might benefit from this education. And otherwise, if you don't already know Dr. Fabi, she is an incredible board-certified dermatologist. We're really honored to have her at Cosmetic Laser Dermatology. She's world-renowned. She teaches physicians all over the world. Her results speak for themselves. If you have not seen them, you can follow her on Instagram or us and see on our before and after gallery. And she is going to share a lot of her knowledge today. Of course, we do have 7 board certified dermatologists at CL Derm, and any of them would be happy to see you. And today we are hearing from Dr. Fabi. At the end of the webinar, we also have a giveaway with a Dr. Fabi's favorite products in the skincare basket. So please stay until the end. So thank you, Dr. Fabi. Take it away.
Awesome, guys. So your questions are very important, to just being able to really meet the demand of everybody that's on this webinar. Sometimes I take for granted what is inherent knowledge to me. And so when you ask questions, everybody learns. And when you ask the question, no one's going to be saying your last name or anything like that. We might just call you by your first name so that your privacy is protected. So please do ask questions. That way it's beneficial for everyone that's on today. And so with that, y'all can see my screen. I'm going to go ahead and start. And so as dermatologists, we always get this bad rap for, being maybe not necessarily legitimate doctors, but dermatology plays a significant role. It's the skin is the largest organ of the body, and it can actually be a gateway to show us what's going on internally in the body, as well as what we actually see. And believe it or not, in a space that appears to be very cosmetic, conditions like psoriasis or eczema may not necessarily kill you, but these are conditions that have a lot of drugs under development and that a lot of people spend a lot of time, attention, and research to, because ultimately we get judged by how our skin looks to others, and we judge ourselves by how our skin may look. And this is just the reality of the situation. And so the skin does matter. And we're going to be talking about some studies looking at how it affects the way that we perceive and others perceive our perceived age, as well as our overall health status. And so the skin is really the cornerstone of how we're perceived as far as our health is concerned. What we're looking for is skin that is smooth, that is flawless, And this has been associated in multiple studies with one's overall well-being. So when we look at someone, our first impression is cast within 10 seconds of us looking at them, and one will automatically judge how healthy that individual may be depending on how flawless their skin looks. And when we talk about flawless, we're talking about one that is free of lumps, bumps, redness, pigmentation, blood vessels, rough texture, as well as fine lines and wrinkles. And so skin is almost one's visual certificate of health. And that's why it's so important. And so when we look at it from a biological and evolutionary perspective, we can take two of my patients, for instance, and you can see both are actually 50 years of age. But one, it looks actually after a laser resurfacing on the right-hand side, perhaps perceived as healthier or more youthful. So as you kind of look, two people, same age, both with excellent bone structure, both with very good facial volume, both with very pretty eyes, good brows, what is going on? Both with small noses, good chins, decent jawlines. What is the difference here? And this is just kind of an example of how the skin plays a role. And so in some studies that have been done, the skin condition is supposed to be a reliable signal of actual female mate value. So this is very, if you look at biological evolutionary research, it has been historically something that people actually gauge how fertile one is, how strong their immune system one may be. And this is I know it sounds very primitive, but ultimately this is this is the very first thing that ends up guiding one's first impression, something that is so raw before our intellect kicks in. Flawless skin is the most universally desired human feature, and males are expected to be most sexually attracted to female skin that's free of lesions, eruptions, warts, cysts, tumors, acne, and excess hair. And so it's no surprise then that we have an industry that addresses all of these, from acne to acne scars, to excess hair. But it's always, the patients that are watching and learning, I'm always one that likes to understand why are we doing what we're doing? And there are many clinical trials to actually show why humans prefer this. Historically, it's been something that has guided us about males to females as to what one's hormonal status may be. Are they actually in menopause? Are they going into menopause? And I'll be talking about some of the changes that I can tell when someone is starting to have these hormonal fluctuations, because it is a visual cue for their overall health status and their hormonal status. We know that hairless, smooth skin is a sign of fertility because it's a visual signal for increased estrogen and a decrease in androgen. So that androgen can be high, not just in someone who is going into menopause, but it might be high in somebody who's even in their teens. And that's the reason why they're battling with acne, which 80% of individuals will eventually deal with in the United States. So it's more than just, bumps and redness and something that's annoying to conceal. But the reason we're trying to conceal it is at a more primitive level. It's a visual cue for our overall health status and hormonal status. Now, when we continue to look at some of these visual cues, what we know is that when we see increased vascularity, so not just acne, but redness, rosacea. Now, if it goes too far like rosacea, then it's something we want to bring down. But when we have a little bit of rosiness, what we find is that it is a visual cue in studies for increase in physical fitness, as well as increase in estrogen levels, as opposed to when the skin is kind of dull and loses its color and actually looks more yellow. So what we have found in studies of looking at diabetics, as well as those with hypertension or high blood pressure, is that usually they have decreased skin vascularity. And so you see less rosiness or dewiness, which are again, visual cues for possible health. Increased blood oxygenation also shows that it could be a cue for someone having greater aerobic fitness. And that's the reason why the face has more blood supply or blood flow to it. Where if you have a greater blue tint to the skin, this could be a cue for more cardiac or respiratory illness. So again, these are very biologic primitive cues that I'm covering. I'm going to go into more of just practical applications of what we do and what you can do, but I like to cover a little bit of the historical evidence first. Light skin is considered more attractive, which is why all over the world you have people, taking oral or IV glutathione to lighten their skin. There's a reason why people are trying to do this, and that's because in studies, evolutionary biology studies, people have generally preferred lighter skin. It's considered to be more attractive, and it's taken as a sign of femininity, youth, as well as overall fertility. Now, when we talk about wrinkles, this is usually, and just surface roughness, this is usually more of a cue for someone's age, where cues of redness and brown spots are usually cues of someone's health status. So different lasers or products are going to help with one thing over another, and then you can kind of pick and choose. And so this was actually one of the trials looking at what people preferred. And you can take a look at the very top. This is what the original image of the girl was. And then they added a little bit of redness to her lips. And you can also see that they also took away redness from her face. And they added more blue tint to her face. When she was more blue, even if her lips were red, she was not as preferred as when she was red and had more red lips. And so red lips, not just full lips, but red lips, and also having a little bit of just blood flow to the face is a cue that someone is younger as well as healthier. When she's more blue, she looks unhealthy. Now, if you keep the lips constant and then you add more tan to the face versus lightness to the face, she looks older when she's more tan. And you can see that someone who's a little bit lighter actually looks younger. And then when you keep the lips constant again, and then when you add the redness to it, what you can see is when you add yellowness or decrease yellowness, again, a little bit of yellowness is better and preferred than having this kind of blue lack of color to the face. And so these are just, little things that we're mindful of when we're recommending different laser procedures to add to the overall health appearance of a given individual. So we offer in our practice, what we're known for is a laser procedure called Take 10, which all of us perform. And you can see that woman that I showed you very early on, who's 50 years old, and then you can see her after we've done the Take 10 laser procedure. And that involves 5 different lasers when we do the Take 10. There's one that addresses the brown spots on the face, as well as the red blood vessels and the redness to the face. And so that is going to help one look a little healthier, because we know that brown and red contribute to health cues. And then I take a fully ablative CO2 laser and I really work around the eyes to smoothen out the lines and wrinkles, because we know that lines and wrinkles participate in the cue of how old someone may be perceived. So a little different. And I take that same laser and I go around the mouth to do the same. And then I layer that with a fully ablative erbium laser before I blend it all in with a fractionated CO2 laser. So it's a couple of lasers, but that's why in the after photo, if you really look at her, what is making her look healthier? There's no doubt that she looks healthier. She has had no filler done. She's had a little bit of Botox done, but that was before the laser procedure. So the only thing that's different here is her skin. And the reason she looks younger is because she's dewier. So the surface topography of her skin is not as rough, it's not as dull, and she doesn't have as many deep wrinkles around the mouth, as well as crepiness and darkness under the eyes. So this dew and this glow that you can get from a laser with no filler or Botox can really make you look up to 10 years younger. That other beautiful patient that I showed you, well, if you look at her from before and then you look at her after, you can actually see that she didn't always have as dewy of skin. In fact, when she was in the before photo, she's 44. In the after photo, she's actually 50. And closer to menopause. But you can actually see that her skin, even though she's changing hormonally, some of these lasers can actually mask that by stimulating new collagen production. So the benefit of the Take 10 is that it not only makes the skin tone more even, because I'm personally doing an IPL combined with a Q-switched alexandrite. So that's for overall health, but also you're addressing the wrinkles and you're thickening up the skin and you're promoting cell turnover, which makes the skin look more dewy. And that's why she looks not only healthier, but she looks younger in the after photo. Now, you don't have to be 50 to start doing these things. So this is an excellent example of a woman in her 30s. And when you look at her before, yes, she has brown spots, but if you have like an overall first impression of her from the very beginning, she may look or perceive to you to be a little bit unhealthy. That is normal human judgment, because that is something that we are basically wired to judge for, just from our primitive ancestors. And so when you look at her after doing a Fraxel dual procedure, which is what I did, and I wiped away her pigment, and then I used a little bit of Botox to soften the wrinkles around her forehead and her eyes, she looks, just 2 weeks later, she looks more youthful, yes, but more importantly, healthy. No fillers here, guys. So skin matters. I have a lot of patients that won't invest in their skin because they see more posts on fillers and Botox on Instagram. And a lot of these laser companies don't necessarily invest in direct to consumer marketing to all of you. And so that doesn't mean, though, that there is not a value to these procedures. And so you can see that she has restored her glow and she looks healthier. And that's in every angle. Melasma. Melasma is also a condition. So obviously we have skin damage that comes in even when you're in your 30s. This is a patient that started off with me in her late 20s. And this is a condition that can affect even a very youthful 20-year-old. In fact, that's usually where we see this condition because it's a condition that is multifactorial, partly genetic. So you have the genetic makeup, and then something happens, whether it's a sunburn or it's an oral contraceptive or pregnancy, that unmasks the condition. And then you get this patchy pigmentation everywhere, which is very different than the last patient that had individual brown spots. For most people, you probably can't tell the difference, what the diagnosis is, but for a dermatologist, and that's why it's important to see a board certified dermatologist, we recognize the nuances of the differences in pigmentation. It's not just all lumped into the same category, and it shouldn't be, because your approach to one person is going to be very different than somebody that just has pigmentation secondary to sun damage. If somebody has pigmentation secondary to melasma or secondary to an inflammatory condition or acne bumps that have resolved, you're going to treat it and manage it a little differently. Now with her, I did the Fraxel dual, but there is a possibility that a laser can make this condition worse. So you want to be in the hands of someone who knows how to manage and put you on the right products to minimize that risk so that you can get the benefit like this patient had, where one treatment offered her up to 80% clearance in her melasma. So when you look at her in the after photo, she looks, again, younger, yes, but I really want to focus more on something that I post a lot about on my social media, which is femininity and health. It's not just about looking younger. Younger will happen as an indirect result, as a secondary benefit. If that's your only goal, sometimes you can end up missing the mark and look peculiar. But when increasing your femininity and making yourself look more attractive is the goal, then in fact, you still preserve you, and we're just making you a better version of yourself. So with her, she's here, one treatment 1 month later in a trial that we did. A single treatment with the Fraxel dual improved pigment about 60 up to 80% in those with melasma, and results lasted, maybe not as much, for 8 months, but you still had results. And then this is something you can easily maintain with a clear and brilliant Permea. So not any clear and brilliant, the clear and brilliant Permea. Now, for those that are jotting down, what laser did I do? And I'm going to go, down the street to the mall and get my laser there. I warn you that it's not just about the laser and the brand, but it's just as much about the person who's administering, how quickly they're delivering that treatment, the energy that they have that laser treatment at, the density that they have that laser treatment at, and the after the care that they put you in. So it's not apples to apples, guys. Acne. Acne is a condition that will affect 4 in 5 people at some time in their life. And we're actually seeing this increase even more in 30 and 40-year-olds. This beautiful patient is in her 20s, but it's now affecting the ability. When you look at her, you may think like, what are you eating? You're eating too much chocolate. You're eating too much, dairy. And again, it's like at a very primitive level, you're judging health by looking at the quality of one's skin. With her, we actually elected to do photodynamic therapy to get her to this after photo. And I then at that point did a couple of Fraxel restores to help her with her acne scars. But let's talk about photodynamic therapy. The photodynamic therapy that you may be able to get at your just dermatologist office that's covered by insurance uses a topical product called Levulon, which gets absorbed by your oil gland. And then it sits there for about 3 hours. That's at least what we do in our office before they activate it with a blue light, let's say, at your derm's office. The limitation there is you generally need to do about 3 treatments, and you never really see more than maybe 50 to 60% improvement. Here she is after a single treatment. And I usually tell my patients 80% of patients will have 80% improvement by 1 month. And then you continue to see improvement for up to 3 months after. And so that's what you're seeing here. Now, the alternative is Accutane, but not everybody wants to take an oral medication to improve acne. And so this has become really a gold standard for the treatment of inflammatory or cystic acne, as you see here. Why is it so important? Is it because these people are vain? I mean, in fact, this is the reason why I'm a dermatologist today, because I had acne just as bad as she did. And I did oral antibiotics for 2 years that did not work. And then I did Accutane, and Accutane works, but it left me with dry lips and dry eyes. And even when I got off of it, it doesn't always last forever. And so I did 2 photodynamic therapies personally in my 20s, and it got me to better skin. And so this is the reason why I do what I do and why I feel passionate about dermatology. And recognizing that laser treatments are beyond skin deep, there is an emotional, psychosocial benefit to having clearer skin, in addition to the way others perceive our age and our health status. So with her, she went through about 5 days of downtime, because that's the negative thing with PDT. It's an aggressive treatment, but after a month, there's nothing that gets you this clear after a month. And once you've improved that acne, then you can address the acne scars. People come in and they want us to treat their acne scars, but they still have active acne. That's kind of like chasing your tail. You're spending a lot of money in things that you're going to continue to have to chase because you're still getting active acne. So you've got to get the acne under control. You can do PDT, and you can also do, like I said, Accutane or spironolactone. Those are other common treatments for inflammatory acne. Spironolactone if you're a woman. And so with this beautiful 20-year-old, you can see her after 2 Fraxel restores. And here I combine an IPL to address the redness. And then I do a Fraxel restore on top of that. That's called a photofractional treatment. You can also do a pulse dye laser to address the redness from the acne scars, and then the Fraxel restore. It's really the combination that's going to give you a better result. And there was a great trial that showed that if you combined the 2, you got a better result than if you only do a Fraxel on one side of the face or an IPL on the other. So I always combine them. We have the luxury to have all of those devices in our office to be able to give people better results. And it's not just in women. This is a 14-year-old boy, but already getting really, really bad acne. And that's the reason why it's important to intervene early and not just sit and wait like I did on oral antibiotics for 2 years, where it didn't make a difference and I ended up getting acne scars. Now, that treatment that I mentioned to you, photodynamic therapy, originally is FDA approved for the treatment of precancerous spots. So this is a woman that had these kind of red spots, and these spots that kind of get a little crusty, and you pick at the crust and it goes, and the crust goes away, but then a week later you've got crust there again. That may be a sign of a precancerous lesion, and up to 10% of those can become a squamous cell carcinoma. That's the reason why we are very aggressive about treating these as well. And so your regular dermatologist may freeze them, which is great. It's probably the gold standard of treatment. There are other topicals that one can do where they look crusty and angry for about 6 weeks, but this is a more sophisticated treatment that we offer in the office. And you can see her after just one session of PDT. It doesn't just clear the brown spots and signs of sun damage that she has and the redness she has in her nose, but it also clears those kind of crusty red spots that she has on her cheeks that are precancerous. And it's a popular treatment that we do not just in women, but these treatments are also available and done by men. They may just not be as forward to allowing us to use their photos, but this man did. He was lovely. And you can see all those little red crusty spots. Some people think it's acne. It's not acne. This is not, a red bump from sun damage. This is a precancerous spot that does need to be addressed. And here he is with, yes, no precancerous spots, but also look at the improvement in his redness, in the dullness of his skin, in the muddiness of his skin. It helps with all of those things because photodynamic therapy gets absorbed not just by precancerous spots, but by your brown spots, your blood vessels, and it also promotes cell turnover, which makes your skin smoother and less dull. And then there's pigment. This is a beautiful patient of mine. She's been a patient of mine now for about 10 years. She's in her 20s here. She's now in her 30s, and she's been suffering with pigment forever. She's got the individual freckles that you see here, and you can improve that. And you can see how much healthier she looks by just removing those brown spots, because the brown spots make the skin look dull. As you saw in that one study where they added tan to the skin or where they added yellow to the skin, it makes the skin look sallow and unhealthy. But when you uncover that and you're able to add more even tone and more brightness to the skin, she's perceived as healthier looking. And it's not just pigment, but also redness. Yes, some redness is a sign of fertility and high levels of estrogen. But when you start having dilated blood vessels on your face and individual little telangiectasias and capillaries, that's a sign of rosacea. And things like heat, sun, alcohol can make it worse. But it's just something that's genetic and that really comes on after the age of 30. And you could even get bumps that are associated with it. And so the standard of care for the flushing, the redness, and the blood vessels is laser. And so we in the office do either an IPL or a pulse dye laser. This beautiful patient of mine, who's been my patient now for over 10 years, she just does IPL. Now, the unfortunate thing about all of these procedures is that you have to keep doing them to maintain the result, because unfortunately you keep aging. As a patient told me yesterday, you can't stop a train that's going south. You can only slow it down. And so we're slowing down the process. If she never did anything, she would just be eventually covered with a lot of purple blood vessels all over her face. If the last patient who had a bunch of freckles didn't ever do anything, she would just be covered with more freckles all over her face by the age of 30. So doing things helps the prevention of it getting worse, but also improves the skin quality. And so with her, she's still rosy, but she doesn't have as much rosiness to her skin, making her look a little bit brighter and making your eye focus on her eyes more than on her cheeks. So I've talked a lot about various different skin conditions, all that affect the way that we perceive others and their overall health status. And so I'm going to have Risa ask a poll question now.
All right, everyone, here we go. So It should have popped up on your screen if you're here on Zoom. Skin condition is a signal for how healthy someone is. True or false? So I'll give you all a few minutes, 2 seconds to answer.
We need some music, Lisa. We need some Jeopardy.
Yes, she's trying something on my phone. All right, last couple seconds here. All right, let me share the results.
Yes, so 93% of people were listening. And yes, skin condition is a signal. It's actually our visual health certificate. And that's something that is known and that's very much published in our literature as physicians. And so something to note. Now, the reason people come in is not just because their skin actually, they don't perceive that their skin makes them look unhealthy. They may be bothered by a brown spot or a blood vessel, and that's why they come in, or an acne bump. But a majority of the reason why people come in is because skin participates in the way that we're perceived by others as far as how old we are. And so there's some interesting studies on that. Perceived age, pigmented age spots, wrinkles, and the appearance of sun damage are influenced more or less equally by genetic and environmental factors. When we remove certain visual cues, such as fine lines and wrinkles, but preserve skin color, so you preserve the brown and the red, it's actually been estimated that a face can look 10 years younger. That's why we call it Take 10, because we're essentially effacing or improving a lot of those wrinkles, fine lines and wrinkles. In contrast, when there have been studies that have digitally altered images and have removed or have added brown spots and redness to a face, most people will perceive the age of the person with more brown spots as up to 5 years older. So brown spots and redness, things that you can address with things like an IPL or a pulsed dye laser or a Q-switched alexandrite or a Fraxel dual, those things will help improve your perceived age by about 5 years. And so where are we getting these trials from? So you can actually look at these monozygotic twins, both 60 years of age, A on the left, B on the right. And you can see by just adding wrinkles, so that skin surface topography in patient B, she actually looks like her stated age when she was evaluated by people. This was in a study that was done, versus her twin that doesn't have as many deep wrinkles, and she was perceived to actually be 6 years younger or 5 years younger. When we look at these dizygotic twin pairs, 71 years of age chronologically, if you look at D on the far bottom right and you look at C on the bottom left, that 71-year-old was actually perceived to be 82 years old. So 11 years older just by having all those deep wrinkles. So those deep wrinkles matter. And the way that we improve these are laser resurfacing, our Take 10 procedure. No amount of filler is going to address this. In fact, you do not want filler to be injected into these etched in lines on your cheeks, because it's going to make your cheek look heavier, fuller, and you will look like a chipmunk. And so I'm going to show you photos of people that have really, for whatever reason, they don't want to do lasers, or they want a quick fix that they think that Botox and fillers can give them, because there is downtime associated with the laser. And you'll see that they don't get as much of a result from the fillers and the Botox, not because the fillers and the Botox don't work, but because it's not the procedure that's going to give you the most bang for your buck. And so that's where it's really important for you to trust who you're seeing and know that they have the right lasers and devices to recommend to you to address these issues. And they're not just recommending whatever 1 or 2 lasers it is that they have. So this is a great example. She's a beautiful 6-year-old patient of mine, great bone structure, good jawline, but those deep wrinkles are really what's aging her. And one treatment with Take 10, 1 month later, you can see she literally looks 10 years younger when you improve those deeper wrinkles. This is another beautiful patient of mine, 60-year-old. Now she, unlike the other patient, they're both 60, right? But this patient has been on a skincare regimen for the last 15 years, where others might come and do things a little bit later. That doesn't matter. We can still make a significant difference, but you can see she looks pretty young for 60. Now with her, I did more than just the laser resurfacing. I relaxed her wrinkles, which I always do before laser resurfacing, 1 to 2 weeks before, because there is a study that actually shows that if you relax the muscles before you laser resurface, you get a better result from the laser resurfacing than if you don't. And then at that same time, I actually injected a biostimulator to stimulate new collagen production. I use Sculptra, and that's what I used in this patient. And I put that along her cheekbones, along her jawline. This patient was actually featured in Real Self because you can see how much younger you can look just from a non-surgical, less invasive procedure. So she didn't have a facelift. What I have found from injecting that biostimulator before the laser resurfacing is that it draws in a bunch of cells called fibroblasts. Those cells are the cells that lay down collagen. Those cells get sleepy when we get into our 40s. And so if you try to stimulate collagen with just a laser alone, in some patients, you may not have as robust of a result than if you kind of bring in those cells by laying a biostimulator down like Sculptra about a month to 2 weeks before, and then you can have a more robust result. This is another beautiful patient of mine. She, had a little bit of jowling and had these deep wrinkles in her jowls. Now, people just want me to inject those wrinkles, but again, that's not a great idea. Sometimes you have to actually pick up the jowl a little bit by putting filler along the jawline. In a case like that, I like to use a hyaluronic acid filler like Voluma, and put a little bit of filler along her cheeks and chin, and then I can go ahead and laser. And so the way and the analogy I like to explain to patients is that if there is a significant amount of volume loss and you're trying to laser away all the wrinkles, I liken it to what's happening with your dining room table. If you have a 6-person dining room table and you have a tablecloth over that dining room table, you're born with that tablecloth that fits that 6-person dining room table perfectly. And that dining room table is shrinking to become a 2-person cocktail size table, but that tablecloth is the same. It is going to bunch and gather. And that's what's happening with our skin. And so if I go iron out that tablecloth, but the table underneath it is still a 2-person cocktail size table, those folds are going to come right back and bunch up again. So sometimes you do need to create a scaffold. You need to build out that table, not necessarily to a 6-person dining room table again, but to maybe a 4-person dining room table, so that when you iron out the folds and the wrinkles in that tablecloth, like I do with the laser, then that result sets in and stays versus bunching up all over again. So sometimes it is necessary to do a little filler before you do the laser resurfacing to get the optimal results. Now, when we do these procedures, we're, for the nerds out there, because I have some patients that are nerds and like to know, that they're really adding value more than just looking, more than just addressing their vanity or perceived vanity. They want to know that when they're doing a procedure, they're actually changing their biologic clock. Well, they are. In fact, there was a study that was done in the Journal of Investigative Dermatology, and they took biopsies of patients before and then after they did 3 IPLs. And what they found was that genes that were expressed after 3 IPLs were similar to that of gene expression in a 20-year-old when they looked at 60-year-old people. So when we actually are doing some of these treatments, we're actually reversing the biologic clock to a degree. In another study that was done, one of the largest of its kind, looking at over 2,500 patients using the Luminous IPL that we have in the office, which is actually one of the highest powered IPLs. So not all IPLs are equal. They're not all made the same. The one that you may get at the mall may require 6 sessions versus a high quality IPL may only require 1 to give you the result that you need. And so in this study, they looked at patients that had had at least 3 IPLs in a period of up to 12 years. They needed to have a minimum of 1 IPL a year. And what they found was that 12 years later, they actually looked 13 years younger. So keeping up with your IPLs after maybe a take 10 laser, or even if you never do a take 10, but you just do IPLs, will give you better results than if you don't do anything. And in fact, perceived age will make you look younger. And that was a study done in Asia. Now, this is a little placeholder to remind you all that we actually just completed a trial in our office, and we're always trying to kind of stay ahead to give you guys the latest technologies and the latest treatments. Sometimes those treatments can be in the form of combining. And so what we found was that when we did an IPL on one side of the face and then combined it on the other side of the face with a clear and brilliant on the same day, the side of the face that had the combination looked statistically better by those that had the combination than the side that just had either the IPL alone or the clear and brilliant alone. In fact, all of the subjects, all 40 of them, elected to come back and get the other side of their face balanced because you could see a difference between both sides. And so in our office today, we like to combine them, and we call this the photofractional light. And so now you have a little bit of an understanding. Reese, I think we have a poll question before I go into what are the most important factors to appear young.
Yes, we do. Here you all are. So for this one, there's 2 questions in this poll. The first one is improving facial discoloration decreases perceived age by, is it 1 year, 2 years, 3 years, or up to 5 years? So if you're improving your facial discoloration, so we're moving brown spots. And second question, improving your skin surface, such as fine lines and wrinkles, can decrease a female's estimated age by up to 1 year, up to 5 years, up to 7 years, or up to 10 years. There's 2 questions on this, so we'll give a couple more seconds. Let's see how well we all do before Dr. Fabi tells us the answers. So 3 more seconds, get in your last votes. All right, let's end it. Okay, go.
Awesome. Yes. So 95%. Thank you guys. Yes. Improving skin discoloration, whether it's redness or brown, not only improves one's visual cue for health status, but also can improve perceived age by up to 5 years. But in improving skin surface topography, which are fine lines that actually set in by the age of 33, as well as deep wrinkles, and also improve the texture of the skin, whether it's acne scars or just the roughness that we all develop with age, that can actually improve one's perceived age by up to 10 years. So 77% of you all got that right. And that's the reason why we call it the Take 10. Now, just like a little added bit on skin surface topography, we talk about wrinkles, we talk about fine lines, but you'll hear me talk a lot about glow and dewiness. And you'll notice that fine lines and wrinkles don't necessarily make that, yes, it can make it worse. You're covered by a bunch of wrinkles. But the reason why our skin doesn't look as dewy with age is because our skin turns over, like you're shedding right now. You look down, you don't see your skin cells, but they're there. And you're shedding about every 28 days when you're in your 20s, that top layer of skin. But then as you get older, if you're 30s, it's like 35 days. 40s, 42 days. By the age of greater than 50, you can be up to even 60 days where your skin is turning over. And so those dead skin cells sit on your skin, and they essentially cast a shadow that is perceived by one as dullness. So your skin doesn't look as shiny and dewy as it once did. And that's because of all those dead skin cells. So there are devices that assist in that turnover, and that's like the clear and brilliant. And that's the reason why we couple it now with the IPL to promote cell turnover so that we can mimic that turnover of younger looking skin. So when we look at clinical trials, what are the most important factors to appear young, right? Because this is still an important thing that many people want to know about. Why does Jennifer Lopez look 25 years later, look the same? She would say that it's because of olive oil. Why does Jennifer Aniston 25 years later look the same. And this is another thing. And the reason why I really highlight these two women is because they don't look transformed. They don't look different. They look still like themselves, but they look like they've been suspended in time. And so what are the factors? We can all of us on this Zoom call would say, yeah, they look pretty good. But the scientist in me, the researcher in me, always wants to understand why. Because if I understand why, then I can apply it and share it with my patients. And I can be mindful of it when I create a treatment plan for my patients. Like, I'm going to choose what's going to give them the most bang for their buck to preserve that more youthful appearance and still keep them looking like themselves. And so when there was a study that was done looking at over 162 people in the UK, and they gave them a bunch of images and they surveyed to kind of gauge what made people look younger or older. The three individual factors that independently correlated with how old some women looked for their age were skin wrinkles, lip height, and hair graying. And so for the women who want to keep their hair gray, that's beautiful, but just know that it participates in that first impression, in that 10-second glance when someone looks over and can judge roughly how old someone may be. These are the factors that where their brain is really assessing, and they may not even be conscious of it. And this is the very reason why the Take 10 is such a popular procedure in our office, why Botox is still the #1 cosmetic procedure, because it's helping with wrinkles, right? Lip height. More and more we're seeing people get lip lifts. Be cautious with that, as I've seen asymmetries, and sometimes the scar may not be very appealing 5 or 10 years later. But another reason why people focus so much on the lips, recognizing that it's not about lip projection, is sometimes making the distance between the base of the nose and the border of the lip shorter. And then hair graying, which you guys can just color. But things that we do is that we're noticing that injecting PRP into the scalp not only promotes increased hair density by about 20 to 30%, but we're noticing that the quality of the hair, the coarseness of the hair, and people that claim that they historically gray more are not graying as much. And that's because that PRP is helping with those stem cells. In another study that was done in Denmark, again, looking at a lot of subjects and then having the lay rater judge those subjects, what they came to the conclusion was that sun exposure significantly influenced how old someone looked for their age because of wrinkling. So again, independent study, wrinkling again, a big cue for how old someone looks. And then also in this study, it was interesting. People could gauge subcutaneous tissue and how old someone looks. So this is, when we look at like a baby, they have that extra baby fat that we call it. But that baby fat is a cue for us that they're a baby, that they're youthful, that they're young. And that is something that we lose. Now, UV damage has been shown to actually affect our fat layer. That was a study that came out of Australia by Greg Goodman. So protecting your skin is more than just preventing lines, wrinkles, and pigment, but also is preserving that subcutaneous fat layer, that superficial fat layer, that some may hate that baby fat, but it's actually what keeps you looking young. And then in another trial that was done, because I kind of try to look at multiple different trials to see, what are factors that really contribute to the way others judge us and how old we may be, is the eye area. So in eye tracking studies, the eye went to the eye first before it went to the nose and the lip. And so the eye area, those wrinkles around the eye are going to contribute to, one's perceived age. How even one's skin color were the main attributes to perceived age. People that were older when they were evaluating images estimated were more driven by lip borders and definition of shape and eye opening, where younger graders, those that were less than 50, typically estimated age and were more driven by dark circles, nasolabial folds, and brown spots. So what this study suggests is, depending on one's age, we naturally have our own biases. So if we're greater than 50, we're going to probably start noticing the things that are bothering us, which are lip borders and lines around our lips. And that's what we're going to be, looking at in somebody else. When we're younger, we're going to probably be biased by the things that bother us, which are dark circles under our eyes, nasolabial folds and brown spots. So as with everything, I talk about biases, whether it's aesthetic biases of the doctors that are treating you or your own bias. We have to be mindful that we all have our biases depending on how old we may be. And so this is a great example. She's a beautiful patient of mine in her mid 50s. But if you kind of, look at her and assess her based on what we've been talking about, the eye area is something that before made her look older. The prominent blue veins around her eyes, which we treat with a laser called the Cool Touch Varia, the wrinkles and the darkness under her eye, which has now been improved by the Take 10 procedure, right? If we kind of look at her skin uniformity, how even her skin is, now that her skin is more uniform, she doesn't only look healthier, but she also looks perceivably younger. And then when you look at her lip length, she has a nice curl to her lip. So that creates an illusion that she has a shorter lip length, which is what keeps her looking young. So the studies, that have been done are pretty on point. This is another beautiful patient of mine who's in her mid 50s. Again, if we kind of take what we've learned and the studies that have been done, you look around her eyes, they look younger. If you look around her mouth, it looks younger. With her, I didn't just do the Take 10, but she needed a little bit of volume. So I did 2 or 3 syringes of Voluma. And I like to, for the patients that are on the call, they know that I sprinkle it all over. If you only put it in one area, because some people just want it in one area, they think it's going to make them look more natural if you just put it in one area. That in fact actually makes you look less natural because your whole skull is shrinking as a function of age. So if you sprinkle it everywhere, that's the point in this photo, is that you can't tell where it is, but she just looks better and she just looks happier. Again, if we take the principles we applied around the eyes, they don't look as dark, hollow, and wrinkled. Around the mouth, the distance between the base of her nose and her lip looks shortened, and she doesn't have as many wrinkles around the mouth. So she looks more youthful and she doesn't have any hair gray. So with that, Risa, do we have any additional questions?
We do. Here we go. So, what factors independently contributed to how old women look? Skin wrinkles, lip height, hair graying, or all of the above? A terrible voice. I won't sing and bother you. But what do you guys think makes someone look old for their age? Is it our lip height, wrinkles, or hair gray? All right. People got this one pretty fast.
Great. All of the above. Yes. Okay. And so now I'm going to kind of jump through because I know people have questions and I want to allow time for that. So in summary, what are things that you can do based on the decade? I know that I covered the decade talk, in your teens for your skin, acne, PDT. In our 20s, we still probably have acne, but now you're developing more redness and pigmentation. So this is an opportunity not just to do PDT, but perhaps even do an IPL for the redness and the pigmentation, or even a Fraxel dual if one has significant melasma. Going into our 30s, this is when rosacea can kick in. So definitely standard of care there is a laser or light, like an IPL or a pulse dye laser. Here, at 33, it's been found that we start developing fine lines. And so one can use neuromodulators like Botox to prevent those fine lines from kicking in. It's not just lasers and devices that can help or assist with the quality of one's skin. Once we go into our 40s, remember, now our skin is starting to look a little dull because it's no longer turning over as quickly as it did in our 20s. So this is an opportunity to start combining that IPL with a Clear and Brilliant. But if you need something more aggressive, you can do a photofractional, like an IPL with a Fraxel Restore. And that's going to help not only address the redness, the wrinkles, but promote cell turnover as well so that you can get that glow back. In our 50s, women start to shift into menopause. That can even happen in late 40s. With that decrease in estrogen, which I talked earlier about, there is decrease in vascularity. There's more sallowness to the skin. The skin takes on more of a yellow tone. There's definitely more roughness, and it's not as thick as it used to be. So this is really where there's an opportunity to do the Take 10, which is the combination of 5 different lasers that we do in the office. Why is skin attractiveness so important? Does poor skin attractiveness reduce perceived results of facial augmentation? Yes. It's very important because if you're investing time and money into doing injectable procedures and you don't do anything for the skin, you're not going to be able to appreciate the result from your fillers. So this is an excellent example of a beautiful patient who just couldn't get to doing something for her skin, but was open to addressing her volume loss. But you can't appreciate the augmentation or the volumetric change when she still has the wrinkles. So it can be distracting and maybe taking away from the investment that you're putting into your injectable procedures. Not just her, but this beauty as well. Yes, is she a little fuller? She doesn't look as drawn? Yes. But you can appreciate the full result of her injectable Sculptra when she still has the pigmentation, the redness, and the wrinkles. So definitely it's almost like an added value. There's like a synergy to the investment you're putting into your injectables when you're also doing something for your skin. And it's not just the face, it's also the arms. You can address the crepiness in the arms. That makes you look younger. Like this person, if you looked at her chest on the left and then you looked at her chest on the right, there's like a 20-year difference. And this is with a combination of therapy, Sculptra, and IPL. And she's in fact 3 years older in the after photo. So you can apply these concepts, not just to the face, but to the neck, chest, and everywhere else in between. I want to give a quick plug. I do a continuing medical education program once every 2 months, and I'm actually going to be doing one next Tuesday. And so this is a series where I cover, for the nerds that are on this call and really want to understand more, this is geared towards physicians as well as providers, extenders like PAs and nurses. But there are people that are always asking me, and so you can kind of tune in. Maybe some information will be over your head, but maybe you'll learn some pearls. And you can register for a future episode by going to www.thrivinginesthetics.com. And so with that, if you don't follow us at Cosmetic Laser Dermatology, you should. If you don't follow me, I'm at Sabrina.Fabi on Instagram. And we're going to open it up to questions.
Okay. Should we ask our one final question first?
Yes.
Okay. Last poll, guys, real quick. So to recap everything Dr. Fabi taught us, a great anti-aging regimen, does it involve Botox, fillers, lasers, or all of the above? And this is if budget is not a concern. The best anti-aging regimen.
Mm-hmm.
Why don't you just give it away? Mm-hmm. All right. And let's get this ended so we can get to questions. All right.
Awesome. Thank you
You
so
guys
much.
were listening.
Yeah, you were listening. And Risa, you bring up a good point. If, budget, obviously we recognize that budget is a concern for a lot of people. And so I would say that in my experience of treating people for the last 11 years is that the people that look the best and look the most like themselves, just a better version of themselves, are the ones that come in frequently. They may not do all of it, but they do a little something every 3 months, whether it's an IPL or a Clear and Brilliant in one visit. Then they do a little bit of Botox on another visit, then a little bit of filler. And so every tissue is being addressed in the aging process so that they look like a more natural version of themselves 10 or 20 years later.
Absolutely. That's a great point. Okay. We're going to try to get to as many questions as we can. We know it's a little late for some of you. I don't want to remind you if anyone has to leave, this is being recorded, but please stay on a few more minutes for our giveaway. So Dr. Fabi, when is it better to opt for surgery, especially regarding the jowls?
If you are looking for complete eradication of the jowls and you want 100% improvement, that's the time when you should consider surgery. The injectables can improve things, but even I will do, depends what you mean when you say surgery. If it's fat and it's fat that's kind of coalescing into the submental area, your neck, you might be a good candidate for thermi with microlipo, which I also do in the office. So maybe not a facelift, but you can definitely do, something that's more minimally invasive, where you just had 5 days of downtime and there's really no, scars. We go in with a little needle. So that's an option. But if you want perfection, then I usually say, I tell people to go for that lower face and neck lift.
That's fair. All right. So this is an easy one. How often do you recommend an IPL for maintenance?
I recommend it every 6 months. Just like your, dental health, I kind of consider it your skin health. And so I like to recommend one combined with a Clear and Brilliant every 6 months, no more than every year.
So if your goal is to even out skin tone and get rid of sun damage or hyperpigmentation, what laser treatments do you recommend for someone with some tan or olive skin?
There are many different lasers for tan or olive skin. It depends on what the pigmentation issue is. If it's melasma, Clear and Brilliant Permea, we did an excellent study that showed about 40 to 60% improvement after 4 treatments spaced 2 months apart. And there was no incidence of post-inflammatory hyperpigmentation. So I like to start with that laser because of the minimal risk and the level of result that we saw in skin types as dark as Fitzpatrick 5. So we treated African-American skin, Asian skin, Hispanic skin, as well as Middle Eastern skin.
Yes, and at Cosmetic Laser Dermatology, we have over 50 lasers. So no matter what your skin type is, we definitely are going to have something that can work especially for you. Okay, so what lasers, I guess I'll say, or treatments are recommended for under eye darkness?
It depends again, why does one have the under eye darkness? So sometimes I find that it can be secondary to blue veins under the eye, in which case that would be a cool touch varia. If there is redness because someone has a lot of allergies or genetically they have redness, then a pulsed dye laser is what we use. If someone has crepey skin because that's the thinnest skin of your entire body and is juxtaposed to much thicker skin of the cheek, then I typically will do a fully ablative CO2 laser. Sometimes it's volume loss, and that's because the split between the fat pad under the eye, the infraorbital fat pad, is splitting from the cheek fat pad. And so repositioning the cheek up will improve that darkness.
Okay, perfect. So if I had a CO2 last February, how long do I have to wait to have a take 10 with you?
Generally, there are people that love laser resurfacing. I generally don't feel like it's really necessary to do any earlier than a year. Most of my patients actually like to do it or find that they need it probably after about 4 years. But there are people that really try to avoid the injectables and kind of just stick with lasers. And I haven't ever really needed to do it any earlier than 2 years from when the original laser was performed.
Great. All right. So here's a great question from Mark. He first says, love the painting behind you.
Thank you.
And then he says, during your assessment, what are you looking for when you're deciding your approach for collagen treatments between laser or fillers like Sculptra or threads?
That's a great question. I assess the face by first kind of looking at what the tissue issue is responsible for the greatest change that that person is showing when it comes to signs of aging. So I always look at bone. I look at deep fat, superficial fat. I look at muscle and how much it's contributing to wrinkles on the surface of the skin, or downward pull of the corner of the mouth, or blunting of the jawline. I look at the skin. So I look at kind of every tissue. And then I determine which tissue is making the person look, which one is aging faster than the rest of the tissues. In some people, their skin is rapidly aging more than their bone. Like they've got great bone because they've been running all their life, but their skin is showing the fact that they've been running all their life. And so I'll address their bone issue first. their skin issue first, so that they can get the most bang for their buck. So I assess which tissue is causing the greatest issue so that we can address it first. And by doing that, I find that patients then see a greater return on their investment. And then from there, we may move on to address other things, especially if people are on a budget. Now, some people are like, do everything. And then and that's when you've seen me combine a little bit of biostimulator with a little bit of Botox and a little bit of laser. And that's because they have the budget to allow me to be able to address every tissue issue.
Got it. Okay. So I know it's getting late, but a few more questions. What is the downtime for the Take 10, those incredible results you showed?
So,
which is exclusively only found at Cosmetic Laser Dermatology.
Yeah, because that's about like $700,000 worth of laser equipment. And so the lasers are not cheap. And that's the reason why it's hard for many practices to have all of those lasers under one roof. But I find that you are bloody and crusty for about 7 days. You're pretty significantly pink for between 10 to 14 days. But you can start covering up with makeup at about day 10. I've personally done it myself and it's been excellent. And I was able to be out on a date by day 7. I wouldn't probably tell people to expect that. I'd rather under promise, over deliver, and say like a day 10, you'll be able to probably cover up. If you're I'm not self-conscious, but some people are, and that's fair. So, you could then perhaps just give yourself 2 weeks if you're super self-conscious and you want to really make sure no one can tell anything has happened.
Yeah, I agree. And really, it kind of just looks like you had a really bad sunburn too. So, okay. So what treatments do you recommend to improve neck wrinkles? And I guess we can also refer them to maybe your last webinar as well.
Yeah. So neck wrinkles are very tough. If they are the horizontal bands, that's a different issue. And there I like to combine Botox with a little bit of filler. If it's crepiness, like cigarette paper, I like to do a fractionated CO2. I think it works really, really well. If it's deep etched in lines, you're probably going to need a combination of all 3 of those things.
Got it. Okay. Well, I'm so happy to see a lot of men that tuned in today, and we have a few questions about men. So is there any worry, and how do you address the beard and hair areas in men when you're doing IPL or lasers?
Yeah. So in men, sometimes the beauty about hair, facial hair, and that's the reason why men have less sun damage in those bearded areas or have less propensity to get perioral wrinkles. You'll never really see men with smoker lines. Why is that? That hair is almost serving as an umbrella to protect that underlying skin and collagen. And so it's almost like a sunblock in that way. But it's also keeping that skin nice and thick. So generally people don't need much in the bearded areas, but nevertheless, let's say you did a fractionated CO2, I would have you shave everything and I would laser all of it. The good news with the CO2 is that it's chromophore is water. So it's not going to be absorbed by your hair follicles. So you don't have to worry about that. If you have redness or blood vessels, again, the chromophore there is oxyhemoglobin or red blood cells. So again, it's not penetrating deep enough to have an effect on your hair. If you use an IPL, some men don't care if it's taking their hair. And some men that do, we just kind of stay above the hairline.
Got it. Okay, a few more questions. I promise we'll get to the end soon. There's just some great ones. So how do you decide on Sculptra versus Voluma?
I actually like to use both. So I think that those that are on like a, anti-aging plan with me and have been my patients for so long know that I might even alternate you out. So I'll do Voluma, and then the second time I'll do a little Sculptra, and then the third time I do Voluma, because I'm not, again, it's like, it's a marathon, not a sprint. So I'm not trying to rush to the end result. I'm just trying to suspend you in time. And that means that I kind of change it around, because Sculptra will not add volume, but it will just kind of contract and tighten your tissue and make your skin thick, where there's a benefit to that. And then the Voluma gives you that like immediate volume restoration that happens from volume loss. So I like both, and I personally do both.
Okay, 2 more questions. I just had micro lipo and thermitight, and it's awesome, by the way. And now I would like to begin a skin regimen before laser treatment. Do I come in for a consultation? How do I know what your favorite products are or what's best for me?
Yeah, if you're my established patient, then probably send in an email to my team. And then we'll be able to guide you depending on how far you are. Yeah.
And if you're not an established patient, I can direct you to our website. And we actually have a page that has Dr. Fabi's favorite skincare products. I think her 5 or 6 favorite are all in one spot that she picked out. All right. And does CL Derm offer treatments or injectables that sculpt the nose to appear smaller and more feminine?
Yes, some of our associates do injectable nose procedures. I personally use Botox to shape the nose. There are muscles that widen the ala of the nose. So when you smile, the nose looks wider, and relaxing that dilator nares with Botox can make the nose kind of look smaller when you smile. Relaxing the depressor septi nasalis, which is the muscle that pulls on the bottom of the nose when you smile so that the tip goes down, will ensure that when you smile, the nose kind of remains small and lifted. And then sometimes as we age, the thickness of the tip of the nose, which we call the tip of the nose, gets thicker because of sebaceous glands. And so relaxing that, reducing that will keep that tip thin. And so those are great ways to, creatively putting filler in the nose doesn't always make the nose actually look thinner. You have to be careful. It depends on the size of the nose and what the issue is.
Beautiful. All right. Well, there are more questions, but we do have to wrap up and let everyone get on with their evening. So I do encourage you, Dr. Fabi is available for virtual or in-person consultations. You can actually schedule an appointment on our website now, even after hours, or by calling us or emailing. We definitely encourage you to follow us on social media. Dr. Fabi is a wealth of knowledge, and a consultation with her before you make any decisions, I highly recommend. I'm trying to get in on your schedule myself. So with that in mind, we are very excited to give away a skincare basket with some of Dr. Fabi's favorite products. I believe it includes the HA5, Lytera, and the new TNS Advanced Serum by Skin Medica. Yeah. And for that, we will take a report of everyone that stayed on this webinar to the end. And for your privacy, we will randomly choose a winner and reach out to you privately tomorrow. And then if you're comfortable, we can announce it publicly on social media by the end of the day tomorrow.
Yes, and I just want to thank you, Risa, for always being an excellent moderator and keeping the conversation going. And I want to thank everyone who took time out of their busy week to join in. And I hope that this shed some light on some information you may not have been aware of or known of, and just make you a little bit more mindful of why there's a benefit to investing in your skin. Thank you so much.
Thank you so much, Dr. Fabi. And thank you again for everyone that came. Everyone's saying thank you. So much great information. So really appreciate you sharing all this with us. And I hope you all found it educational. And we look forward to seeing you soon at Cosmetic Laser Dermatology.
Bye, guys. Have a good night.